Hillary, a 30-year-old woman with a history of endometriosis, is admitted to the emergency room. Complains of severe one-sided lower abdominal pain referred to her shoulder. She's accompanied by her husband, John. Hillary is restless and apprehensive and states that she feels lightheaded. Her pulse is rapid and she is slightly hypotensive. A small amount of vaginal bleeding is noted. To assess with diagnosis, a vaginal ultrasound and pregnancy tests were performed. A diagnosis of ruptured ectopic pregnancy is made. Ectopic pregnancy is when the egg is fertilized and implants into the fallopian tube. Normally, an egg is fertilized in the fallopian tube and then travels down the tube to the uterus. Any mechanism that interferes with the normal function of the fallopian tube during this process increases the risk of ectopic pregnancy. Common risk factors for ectopic pregnancy include pelvic inflammatory disease, previous ectopic pregnancy, endometriosis, previous tubular surgery, previous pelvic surgery, and cigarette smoking. Hillary is especially at risk because of her history of endometriosis. Given Hillary's current condition, the main medical concern is to stop the bleeding resulting from the rupture of her fallopian tube. The ruptured fallopian tube and remnant of the early pregnancy need to be removed for emergency surgery. Laparotomy, removal of the affected fallopian tube, is the most common surgical treatment. Occasionally, a salpingofolectomy, removal of the affected fallopian tube and adjacent ovary, is performed if the blood supply to the ovary is affected or the ectopic pregnancy involves the ovary. A primary nursing diagnosis at this time is pain related to severe abdominal bleeding, secondary to tubular rupture as evidenced by severe one-sided lower abdominal pain referred to her shoulder. Hillary is scheduled for surgery to remove the affected tube. Preoperative nursing care includes obtaining assessment data from a full physical examination, including a vaginal examination. Vaginal examination should be done only once and with extreme caution. Laboratory data should also be obtained, including determining of blood type Rh factor, CBCs, and beta HCG assay, obtaining vital signs and assessing pain status. Monitor bleeding and initiate measures to prevent shock. The risk of hemorrhage and hypovolemic shock is common after a rupture occurs. Treatment for shock may include blood transfusion, IV fluids, keeping the patient warm, administering oxygen if necessary. In addition to relieving shock, the patient in need of blood transfusion and supplementary IV fluids therapy to restore a satisfactory blood volume for safe anesthesia and surgery. The patient's emotional status should be assessed. Reassurance and support for the surgery should be given to the patient and her family. Preoperative teaching should include what to expect during the surgery and after the surgery, and it is essential that Hillary is given instructions about deep breathing, coughing, and moving post-operatively. Post-operative nursing care for Hillary should include frequent monitoring of vital signs and temperature, and a respiratory assessment to evaluate airway patency permits the nurse to recognize early signs of respiratory problems. The patient's level of consciousness, orientation, and memory should be assessed, as well as the size, reactivity, equality of the pupils should be determined. Effective pain management by assessing for pain and inquiring about the type and location of pain, as well as administering medications as ordered by the physician. Monitor intake and output and assess the bladder for distensions. Monitor for passage of flatus and return of bowel sounds. Monitor incision site for bleeding and drainage. Also check for any vaginal bleeding. Assess the client for movement of the extremities. Encourage ambulation if permitted. The iron status of Hillary should be assessed, and Rh immunoglobulin should be administered if appropriate. The patient may express a fear of future ectopic pregnancies and have many questions about the impact of this experience on her future fertility. As Hillary starts to recover from her surgery, she has a lot of questions she wants to ask the nurse.
I am just feeling very sad and don't know what to do. I've been trying to have a baby for 2 years now and thought it was finally happening. I just don't think I will ever be able to move on.
I would encourage you to express your feelings, and I'm here to listen. This is a very difficult time for you and your husband, and there are supportive resources available. You're going to need time to recuperate emotionally and physically before trying for another baby. Most caregivers will advise you to wait at least 3 months after major abdominal surgery for your body to heal before trying for another pregnancy. How is your husband coping?
Well, we haven't really talked about it yet, so I don't really know. I guess we'll just have to see.
Your husband may also be feeling sad or helpless and may have trouble figuring out how to express those feelings or how to be supportive. Since it is so important for both of you to express your feelings and concerns, seeking counseling might be a helpful option that is available. I can give you information on how to get the available resources if this is something you are interested in. An appropriate nursing diagnosis at this time for Hillary is anticipatory grieving related to the loss of a pregnancy as evidenced by stating feelings of devastation and loss.
Okay, thank you. I like that information. I also have another question. Did my endometriosis have anything to do with my ectopic pregnancy?
Yes, endometriosis causes damage and scarring to the fallopian tubes, which raises the risk of ectopic pregnancy. Endometriosis is a condition in which the tissue that lines the uterus grows in other areas of the body and can cause pain, irregular bleeding, and possible infertility. Common locations this occurs are the fallopian tubes, cervix, and ovaries. Less common locations include the gallbladder, thoracic cavity, and heart. Each month, a woman's ovaries produce hormones that stimulate the eggs of the uterine lining, endometrium, to multiply and prepare for a fertilized egg. The lining swells and gets thicker. If there is no fertilization, this lining is shed and the cycle repeats. However, unlike cells normally found in the uterus that are shed during menstruation, the ones outside the uterus stay in place. They sometimes bleed a little bit, but they heal and are stimulated again during the next cycle. This ongoing process leads to pain and can cause scars in the fallopian tubes, ovaries, and surrounding structures in the pelvis. Can I have a successful pregnancy after I've had an ectopic one?
Yes. The earlier you end an ectopic pregnancy, the less damage you'll have in that tube, and the greater your chances will be of carrying another baby to term. And even if you do lose one of your tubes, you can still have a normal pregnancy as long as your other tube is normal. If and when you do conceive again, call your health practitioner as soon as you suspect that you might be pregnant, so that she can schedule you for an early sonogram and monitor you closely. If, on the other hand, you are unable to conceive because of ectopic pregnancies or damaged tubes, the good news is that you are likely to be an excellent candidate for fertility treatments such as in vitro fertilization, in which your healthy embryos are implanted directly in your uterus.
What are my chances of having another ectopic pregnancy?
Overall, your chances of having another ectopic pregnancy are about 10 to 15%, depending on what caused the first one and what type of treatment you had. That means that your overall chances of having a normal pregnancy next time are still very high, about 85 to 90%.
What is that medication again that the doctor wants me to take?
The doctor has prescribed you a medication called Cineral.
What is the purpose of this medication?
Let me explain. This medication is used for women to treat a condition called endometriosis, which is what you have. It is a condition in which the tissue that normally lines inside of the uterus grows in the wrong place. The medication helps to reduce the abnormal tissue growth and its symptoms, which can include painful menstrual cramps, pain during and after intercourse, as well as pelvic pain.
Okay, I understand. How will I take this medication?
The route of this medication is intranasal. You will take one spray in one nostril in the morning and one spray in the other nostril in the evening. You should not blow your nose after using the spray because it may decrease the amount of medication your body absorbs.
Okay, now what if I miss a dose?
Well, if you miss a dose, that is not a problem. Take the medication as soon as you remember. If it happens to be time for the next dose, just skip the missed dose and use the medication at the next scheduled time. You should not take extra medication. Also, I would like to explain some side effects of this drug. You may have hot flashes. These are common, but if they become bothersome, notify your health provider. You may also have emotional instability, headache, depression, nasal irritation, and weight gain. We will also be assessing you for any endometriotic pain throughout therapy. I would also advise you to use a form of contraception other than oral contraceptives during this therapy. Amenorrhea is also expected, and please notify us if your regular menstruation persists or if successive doses are missed. So, do you have any more questions?
No, I don't have any more questions. Thank you so much for all the useful information.